Hello, everyone, and welcome to our webinar today. Excited to share some insightful information on our topic for the day, and hope that you can leave this webinar with enough information to make sound decisions within your healthcare operations. And we're going to be touching on today on one of the most key topics in every healthcare company in the US, which is RCM, and especially focused on how technology can improve service delivery in order to maximize revenue, which, as we know, is one of the key components of this process that is so cumbersome, so complex. And hopefully by the end of this webinar, you'll feel it's easier for you to digest what it is and how to address it. But we want to start first discussing who do we have here. So I'll may introduce myself. I've been in the healthcare field for the last 8 years, working mostly with patient access. My background is in a combination of consulting, finance, and also some software development and software design. But we have our main guest today, which we're very happy to have. Avesh, he's an industry veteran, close to 3 decades in the field, but I'll let him introduce himself. So Avesh, if you want to talk a bit about yourself.
Thank you, Edison. Hello, everyone. My name is Avesh Shaikh. I'm accountable and responsible for RCM operations at GeBBS Healthcare Solution. I come from IT-enabled services in the last 27 years and excited to be part of the healthcare ecosystem. Last 10 years, was able to really work with my experience on ITS services and utilizing technology in healthcare and channelizing a lot of automation within the healthcare ecosystem. My family is almost 6,500 plus people and collectors, including in the RCM ecosystem I work on. Uh, I look forward to talking to each one of you. And Edison, thank you. Pleasure that you brought me here today to talk with the team here.
Awesome. Thank you for joining us, Avesh. So before we start, there's a Q&A section in the Zoom meeting. So feel free to post any questions that you may have. We'll also do a round at the end to answer any questions. But before we start, why are we in a position to talk about these topics? It's because we have extensive experience working with many national, regional, and local groups, healthcare groups across the United States in both patient access and RCM. And what you see is the combination of the expertise of two companies. CCD Health, which is a top firm serving top brands, especially in scheduling, but also serving more than 700 locations. And then the GeBBS, which is the parent company, a global operation having facilities in nearshore, Philippines, and India, managing close to $11 billion of monthly accounts receivable. So it's this combination, this expertise of this huge footprint that allows us to provide insightful information that we can share in this forum, in this webinar. So looking forward. And again, one of the things that we're going to touch on is the whole spectrum, the whole workflow of both patient access and RCM. Moving on to the next slide. Yeah, and what we see here, and Avesh is going to touch on some of these solutions around each of these particular verticals around these processes. So Avesh, feel free to take it away.
Sure. Thank you. And just to begin with, GeBBS Healthcare has been part of the US RCM ecosystem for last almost 2 decades plus. Excited that recently CCD joined part of a family, and we extended our operations in near shore, that's Dominican Republic. We manage absolutely the entire RCM life cycle overall, right from the front end to middle and the back end. And while working on this entire cycle, we observe a lot of opportunity in areas where technology interventions can be done. I'll touch upon it in the subsequent discussion slides, but this is an overall scope suite what GeBBS offers, and touch upon all three P's: the payers, the providers, and the patients in terms of our entire RCM management system. Over to you, Edison.
So moving on to what are some of the challenges that we see in the ecosystem for AR?
So absolutely, just to begin the discussion, we are touching upon very specific to the back end, and AR is the prime area where a lot of challenges comes in. Just to understand AR better, AR is a defect. Every defect post billing is accumulated into AR. Now, when you look at AR cannot be really worked, putting a lot of hard labor. AR needs to be worked with a lot of strategy, a lot of tactics as we take it forward. AR as a standalone is not a function at all. It's a function or a subset of other functions making mistakes. You make one mistake on authorization becomes AR. You make one mistake on eligibility becomes AR. One coding mistakes can be AR. One payment posting mistake can be AR. So AR accumulates a lot of data. And when we talked about, and Edison touched upon that, we manage 11 billion worth of AR every month. That's the magnitude of going through the defects and collecting a lot of insights why it happens. With all this magnitude we manage, and some of the areas we feel that we can bring forward is that more the AR, the highest is the cost of collection. AR contributes to the maximum dollars in terms of cost in the entire RCM ecosystem. All the defects increment, and we'll touch upon the payer behavior also, but the cost of collection is the highest because it is prone to multiple access. It is prone to a long hold times with the payer, will increase the cost further. And if you don't have, you don't have the manpower to manage it, it can get worse. So the cost of collection is the highest with the AR. With this, subsequently, the long payment cycles. Typically, a provider should get his money within the 15 to 45-day cycle. But if you don't have proper management in terms of managing AR, the cycle can go to an extent of between 90 days to almost like 180 days also. It's a loss, actually, by the time you get the cash flow flowing in. And this subsequently have ripple effect in terms of revenue leakage. Every payer have their timely filing days. And if you don't, appropriately attack AR at a particular junction, this will result into revenue leakage in two forms. You all may be aware as subject matter experts to understand that delay in payment decrease the payment also. More the aging, the probability of collecting allowed amount gets weaker. Second, the moment it passes timely filing limit or appeal filing limit, you start losing money. Your gross revenues as well as your net collections really goes down. This is one of the ripple effect of if AR is not managed properly. You visit any hospital, and I was in the US for last 1.5 months and talking about and meeting a lot of hospitals and doctors and set of doctors. If you ask them one problem, everybody have only one problem, that they call it as AR, and that's how it is been looked at. The other areas why this AR ecosystem is impacting big time the providers' overall cost is payer behavior. With so much of data we have, we understood the payer behaviors. Payers are the no responsive payers. A non-responsive payer increases your cost because they say, I will never get back to you. Please call me and find out what is happening to your particular claim. Payer who denies for the first time and pays the second time. Payer keeps on changing their rules, which indirectly impact and increase your defects. More than denial, where payer communicated back to you what is the issue, the biggest behavior is non-responsive. This is the cost which increases on the AR side of it. The next one, as mentioned to you, AR is a defect, and any defect prevention can only happen when you have insights. If you can't use the data after working on AR to produce a great amount of insights to correct the front end, correct the middle end, this continuous cycle will continue and keep impacting your cost on the AR side of it. With this said, actually, there is also some impacts on the patient side of it. If you don't manage AR appropriately between 1 to 90 days or 90 to 120 days, this may have a higher probability of getting flipped to patient. And the moment it gets flipped to patient, actually, or it generates a patient statement and sent to the patient, there is a patient experience issues which starts coming up. Hospitals in the rural area, we manage multiple hospitals where doctor knows the patient and patient knows the whole village. In that scenario, you start facing a lot of patient experience issues and lose a lot of trust. And regulatory compliance also is area, credit balance is part of AR. If you don't timely close it, you may have some statutory obligation to the federal, and this may result in some, compliance issues as well. This are primary AR by itself is a defect, and this has some of the magnitudes in terms of what happens if you don't manage AR effectively. How technology intervention will happen, I'll talk about it, Edison, but these are the areas actually which I feel can be arrested with some technology interventions as we speak forward.
Yeah, and Avesh, I'm sure our audience would probably want to know, based on your experience of close to 3 decades in the space, how have you seen the evolution of the RCM processes and these challenges that you just referred to across those 3 decades? Are they getting worse? Are they getting better? Do the audience have any reason to be hopeful that it's gonna solve anytime soon?
Yeah. So let me give my perspective. Actually, I will not, gauge it with whether it's getting worse or it's getting better. I will only say this is getting more complex. Okay. The best thing is that if this gets more complex, you require more strategy, more technology, more training to work it out. So in the last almost a decade, I have seen that things are getting very complex, and these complexities can be really dealt with technologies. That's what my way of looking at things is.
Yeah. And another point you touched on, Avesh, is in that intersection that is quite interesting between the payer behavior and then the regulatory compliance. I just saw over the weekend that Texas passed legislation legislating and regulating AI in claims denials. What's your expectation there in that intersection between regulatory compliance, payer behavior, and then all the new age AI, which is the buzzword now? What are your expectations there?
Yeah, it's a good question. Actually, Edison, is that everybody's talking about that one order coming out of Texas, but most of the healthcare ecosystem is experimenting right now with technology, or very specifically AI. Now, when you experiment, actually, you don't have any regulatory, framework on that. You will go to an extent to experiment whatever you can. This order is welcome, I feel, because AI, if how much to use it, where to use it, what is the magnitude of AI to be use it, or I can always use the term called misuse also. If an AI can, deny claims based on algorithms, this may create an havoc within the organizations, because everybody will have answer to an AI with an AI. And I think some regulations are required. I still feel that this is very, very early, not only in the healthcare space, but across every industry. But regulations will be required. I think Texas started a good initiative. It may move forward to every state, and regulation is inevitable. This will come in to safeguard patient information, to safeguard provider revenue, safeguard payer revenues as well, or payer interests as well.
Yeah, definitely very insightful on some of the key challenges faced in the space. And I think we would be very interesting moving on to touch on, okay, these are some of the challenges in the space in the industry. However, how does that impact my center, my healthcare operation? How do I feel it? And I know this is something that we're going to cover now.
Yeah, depending, yeah. We will, let's go ahead to the next slide. So I touched upon a few things, but very, very important is the cash flow disruption. Just imagine a hospital or a professional services offered by a doctor. Suddenly you have a huge defect and you don't get a money coming in as a regular flow. We had spoken to multiple CFOs recently, and they have the nightmares that if my cash flow, and cash flow is dependent on majority of them, because of this AR getting piled up, it blocks, and we call it stuck money. AR is nothing but stuck money. Somebody will have to repair it, somebody will have to rebut it to the payer and get the money out. Now, there are expertise, there are training to do it, but cash flow disruption is the biggest issue for any hospital, If the cash flow is not seamless, this can have a lot of impact to manage expenses. Second is that suddenly you see a increase in cost. The more the defects, more the cost. With the current ecosystem where bodies are used, for everything we have to throw bodies in terms of if the accounts are, not getting response from the payer, you start throwing bodies on that. So I think that's part and parcel of it until interventions of technology increases. This continues to be one of the nightmares for most of the hospitals. Regulatory compliance, I touched upon it for any particular healthcare provider. This will always be an area of concern. Compliances and whether I'm trying to pay the payer timely or this will invite some compliance issues for me and stuff like that. The next one is a bad debt. This I think at least cash flow delay is still bearable, but if cash vanishes and this vanishes for multiple reasons, as I mentioned, delay in collection is decrease in cash, or if you delay it further, actually you will lose that cash as well. That timely filing limit and appeal filing limit, I think that is one area to attack very systematically. It can be done in the current form via slice and dices, queuing the system, but this requires more overhaul with some AI interventions in that, or technology interventions still required. But loses money once, you don't get money on this. Poor patient experience, I briefly touched upon. Definitely, end of the day, patient visiting the hospitals or visiting the doctors, if the experience is poor because of payment issues and challenges, and this will have a ripple effect in terms of they visiting the same hospital, same doctor again. So these are the impact for any provider. Everybody actually thinks about this. Every CFO, every CEO started thinking in this direction.
Yeah, I can tell you some of the things that make a finance person lose sleep is the margin and the cash flows. And you touched on two of the key ones here are precisely affecting some of those two key metrics for a company. And I'm sure we want to know as well, Avesh, based on your experience, what have you seen is the number of let's say days outstanding of days of AR for a company that is properly handling their AR processes with technology versus another that is mishandling it and probably doing it without the support of these new age tools?
Yeah, I think different providers have set up different benchmarks, or I can call it different tolerance level based on maybe again the payer behavior. You work with federal insurances or you work with commercials based on that. But I still feel that anything less than 25 days into DSO is something we should go for it. There are some aggressive numbers CFO also set up is that less than 10 days DSOs and stuff like that. But the way payer patterns are changing, it is getting difficult actually. We had seen payer behavior in a span where payer purposely denying the claim for the first time and pays for the second time. So AI actually brings a lot of study and insights with the help of running a lot of data. Where AR is as I mentioned to you, is a data with a lot of insights to use it. So I still feel it may get worse if it gets more than 30 days from data invoiced. It gets difficult and impacts the cash flow management for any hospital. But it all depends on defects and defects after defect. What is you doing to manage that defects by AR channels?
Yeah, and as you mentioned, this is very impactful. Just for illustration purposes for the audience, for a mid-sized healthcare company of $20 million in revenue, a 30-day delay in AR translate into close to $1.6 million that you have to fund for the business. And that might mean a new line of credit, or that might mean even equity that the owners have to put into the company to be able to function with those additional 30 days. So this is very impactful, both in terms of cash flow profile and margin profile for companies. And I know, what we want to touch on really, obviously we cover what are the challenges and what is the impact. But what we want to hear is what can we do about it? What are some of the solutions that are out there in the market, especially related to technology, that can be implemented?
Yeah. So Edison, before I start talking about solutions in different scope of work, actually, where GeBBS healthcare. We are trying to bring a lot of solutions in every scope of work within the RCM ecosystem. But it is very important for everyone to understand, and this is our perspective, because last few years we have been working very, very aggressively in terms of interventions of technology into operations, and we have got a bit of success as well in multiple areas. Now, if you see the entire scope of work between the front end, middle, and the back end, everywhere there's a probability of using technology. How will you define technology actually? Technology can be defined either you're using automation, or you're using basically RPA services, or you're using AI, or between AI also the buzzwords is AI, but generative AI or agnetic AI, what do you use? Let's keep it simple right now. Okay, why do we use technology? We use technology to do more with less, and technology alone cannot stand without a platform. So every technology needs to have a tool or a workflow tool to take it to the human being that's teams. So the technology, if you bring in forward, I'll touch upon some of the technologies, but if you don't have a workflow, this technology will shatter and evaporate in some time, because there is no platform taking it to the human being. As of now, the stage we are into, this is a partnership between the bot, the bodies, and the business rule. Nobody is going to eradicate bodies at all. I don't think that nobody has reached that stage. There'll be some small successes we also got as we drafted a solution. But the current usage of technology is to do more with less, but with humans. What will happen in the next 5-10 years? I think is inevitable. Things will change. The percentage of bots will increase and bodies will decrease. May happen, but it will take some time. Keeping that focus on technology, where to use it, how to automate and reduce, an accelerated collection. As mentioned, AR is the hub of all information, where, what, why went wrong. Now, keeping that theme in mind, let's talk about front end. GeBBS have built automation tool to do one auto eligibility check. Sounds simple that you go in because it's a repetitive task. Go and bring and do the eligibility. GeBBS is able to do auto authorization. Authorization also remains in 3 phases. One is you do a web authorization, you do a call authorization, and in between, how much time you require in terms of getting the responses back from the payer. Again, that's a dynamic to manage by via the entire technology and AI. Coding, most of you are aware that coding, a lot of organization is attempting to do auto coding, but a good success has come in the profi zone, where radiology or some of the specialty which can be done, AI can only take it to the next level. Normally if you do hard coding and rule based engine, answer is no. It changes, the dynamic of this ecosystem changes so fast. Without AI, nothing can happen. As you move forward, actually, we attempted setting up more system-edit scrubber apart from the clearing houses. We feel the clearing houses and the EHR, EMR systems are not up to the mark. Otherwise, there would have been no AR. So you have to enhance that engine while learning from AR, and learning can only happen by AI. Coming back to the post-billing defects, your rejections, your denial management, all this requires a tremendous data. Now, the sequence of this 3 T's, if you go forward, actually the data collection is a non-value-add task for a human being. We at GeBBS actually analyze that when a collector works on an AR defect, he collects a lot of information from clearing houses, from EHR, PMS, document management system, contract management system, and then he brings the data, whatever he has been trained on, try to rebut or repair that denial and conclude it and take action. We have brought the mechanism that all this data, almost 90% of this data, can be pulled in via our RPA solution. And we have bot running every day into every area. Going to the clearinghouse, bringing the information. Going to the EHR, EMR system, bringing some key data. Going to the website consortium, we call it, where sites like Availity, Navigate, Optum, PaySpan, do it every day. Go to the federal websites like Noridian and WPS and bring data. When this data is pulled, there is a processing unit. We semi-conclude this and give it to the body, saying that this is what the defect is. You take this few action, add few decision here, and take it forward. We have seen productivity going up by almost 1.5x. There was a movement because the non-value-added work, the repeated task is taken care of. As a subject matter expert and as a process expert, you start getting into this, you bring more technology. So you start with the thought of automation, you bring in your RPA, data gathering stuff, you bring your process engine. We call it as your overall business rules. This comes from the brain of a SME. Bring that, strengthen it more and more. The more you strengthen the business rules, you can take some direct to action also. So you pull, you process, apply business rule, and then you push. This data can be pushed into any HR AMR system, what an agent or a collector can do. Do we do it extensively right now? Answer is no. There are limitations, and Epic will not allow you to do it. I imagine will not allow you to do it. So we are careful about it, but the competency build over a period of time is that pull, process, and push and bring data from every area. It sounds complex, but believe me, it's a finite world. It requires some good ecosystem of developers. It requires some good SMEs dedicated and invested on the solution, and this happens. So this is an overall perspective given, and it is never two extremes. Either you don't have a mindset to do nothing on automation, or you have a mindset that I will do everything, and you start jumping into AI and generative AI. That's not how it works. You have to take the sequence and move forward.
Yeah, and that sounds like a lot of work that goes into building all these processes, all these technologies, all these tools. And we've always heard from research that any innovation in healthcare take about 17 years for full adoption. In terms of these tools, what are some of the major roadblocks that you have seen for the healthcare companies you work with to adopt these new technologies and these new tools that you have discussed extensively here?
I think I'll be very honest and upfront with dealing with so many different healthcare providers. The first thing first is the mindset. The mindset is we have to adapt, saying that yes, technology will be the intervention to enhance my efficiencies, my effectiveness. Okay, there needs to be openness. Second, it connects with the need, and the need typically comes as a whip from a CFO or a COO saying that we need to improve our margins. That's where it starts. But I don't think you require a whip. You require some passion from the operational leader who running the show to bring that passion and saying that yeah, let's do it and let's enjoy it. These two things sounds very very psychological, but without this taking AI journey forward, AI is not a task. AI requires a good amount of investment. We have to stay invested as an operation leader or operation team. If they don't, as a subject matter experts, contribute, a coder cannot do anything about it. So these are two things I feel is very important for the organization. And third thing very important is ecosystem. Who will develop? Everybody will not have a development team. Organizations like GeBBS actually have 200 plus developers and the ecosystem and the magnet of data. Where, for example, we also have something called as bot as a service. Every SME have an idea of how to automate. Believe me, you put it on a value stream mapping or a process flow, and you get an idea. If I remove this non-valuable step and collect data automatically, I can make it efficient. I'm doing it in 7 minutes today. I can do it in 1 minute or 2 minutes. Every SME have that thought, but don't know how to apply. Point number one, does not have the ecosystem. That's where companies like GeBBS come into play, saying that bots and service, you come with your idea, develop, discover in 1 week, next 2-3 weeks, develop it and take it to your shop. That's the mindset, and ecosystem is required.
Yeah, that was very insightful. I participated in a lot of implementations over the years. And one of the things that we always realize is that the key component of all these implementations is change management, right? What you call mindset. How do you adopt it? How do you approach it? Who's the product owner? There should be an owner, but then there should be a team around it. It cannot be on technology, on the IT team, the information technology team. It has to be mostly from the main responsible for that process. And that's how you become successful at this type of implementations. And I think that's one of the key reasons why many innovations have not been as successful in healthcare. And
absolutely,
there are buckets as well where we can specifically discuss. If we move on to the next slide, where we're going to touch on specifically, what are some broad buckets of technology and broad buckets of innovations that we're seeing are playing a part in the market? So can you walk us through all them, Avesh?
Absolutely. Yeah, maybe I'm getting more passionate with this subject, but believe me, AR have a good amount of data. I think this is a gold mine for all of us. If you don't utilize data after working on AR, you will never be able to, correct the front ends and make system more efficient. And then 80% of the organization and healthcare providers does not use this data to the optimal to correct the front end. Now, saying that, since we have data collected, accumulated to the tune of $11 billion, what we work on in the space of hospitals, in space of professional services, OPDs, laboratories, we are able to collect this data and make a lot of sense out of it. We have a team of almost like 50 plus, Python developers and data scientists who has built algorithm for us. Utilizing this data, we can do some predictive analytics. The best part is that don't let the denial happen and then you spend cost on it and try to bring technology. How can we prevent this to happen? The predictive analytics is that if this combination of this payer provider, this CPT is getting denied for this denial, if you learn that and correct it, it will stop it right at the billing junction, saying that do not go ahead, let me correct it. And this is where I was talking about the EHR, EMR, clearinghouse scrubbers needs to be updated with this study. Second, you can forecast your AR. All the accounts gone out, you have the right combinations given by your AI algorithms and LLMs, saying that this combination will fail. We had seen a probability of failure in the range of, in the current time, 65 to 70%. We are accurate there that this will fail. How can we prevent that? So this modeling was built by us, and something we also call as something as contract mining. Let me speak about this here. Contracts for every hospital is not in a proper shape form. It can be Word, PDF, and stuff like that, not updated in the system. When it is not there, the cases of underpaid increases. Underpaid is the biggest issue of revenue leakages is happening right now. We mine the contract in such a way that we study the payment patterns of the payer with a hypothesis that payer have the right contract, that this payer provider CPT, 78% of the time they paid you $100 for the CPT. That becomes a directional contract. This study is so helpful that when you get a balance or ATP for AR, if it's $100 million, we can tell you that this is only worth $30 million as per our payment plan and contractual obligations. That's the power of putting this data via our AI engines and LLMs. And we have been very excited with these results coming out, and it will only get better for us. Now the sequence continues. This data accumulation, as mentioned, RPA plays a very, very, very important role in terms of data gathering. Anytime you go and collect data, pull data, I think everybody start thinking that I will not let human do it. And everything is a repetitive task. I will let the bots go and do it. Like we have 2,000 almost bots running for multiple clients right now. And every day they go in and bring data for us. Before the operation start, the data is brought in and put into processing unit and start giving it to the agents in the form of conclusions. So robotic process automation is something which is repeatable, something which is non-value add for a human to go every day and do it, and can be given. A small example is that you go to the validity website to find the status. I don't think a human needs to go there. A bot can go every day and bring it to you. Next is the whole automatic follow-ups and reminders. I touched upon the revenue leakage of TFL, AFL. I touched upon that it is one important to work accounts timely. If you work accounts timely, then only the money gets recognized over a period of time. Current system, you have queuing system, you have epics, you have all this, but there is no dynamics of the payer behavior changes. Let me give a small example. A payer will respond back to you in 45 days. It's a behavior, and you start following up in 15 days. That is money wasted. They will tell you claim in process. Believe me, this is one of the small, cost becomes a mountain after some time. But automatic workflow, let the AI learn from your system. Identify non-responsive payer pays in 15 days, payer pays in 300 days. you can get all the data via AI. Pattern gets formed, it's a finite data. The last one I'm touching upon is the AI usage. It's a buzzword right now. Everybody in every area, everybody's talking about AI. But before you go to AI, I don't think you should attempt AI without the first three pillars. You should have a good data collecting units. You should have good predictive analytics and forecasting mechanism, a good workflows, and take that sequence to AI later. AI needs a lot and lot of data to simulate, run, and conclude. If you don't staff AI with data, you will never get the results. So collect as much data as possible. Edison, I feel, and this is we also learned the hard way. If you give them less data, the results will be inaccurate. The
Yes.
more and more data get accumulates, point of time, AI can get more powerful.
Yeah, definitely. And it's a combination of all that data sets and then the right parameters to make sure that you fine tune those AI models, those machine learning models. And however, there's one concern here that we all often hear, Avesh, in regards to how are effective are really these tools that are coming into the market. Because ever since I've been in healthcare, I've heard, okay, this is the silver bullet that will address everything from prior authorization to all the RCM cycle. However, there has not been really that tool that it's that we've seen our partners, our healthcare partners, be satisfied with. What makes this a spectrum of new tools, new age tools, different now?
So let me give a perspective a little differently. So there are players who are third-party players who are trying to build AI solution for healthcare without healthcare ecosystem existing with them. Believe me, it is impossible. If you don't have any, say that I give me some data from a healthcare provider and run my algorithms, it won't work. You have to connect to the healthcare ecosystem to run a lot of analytics first before you even talk AI. A lot of organizations, startups, and they're attempting it. They are trying it, which is good actually, penetrating into AI, but there are good amount of failure stories. Okay, and the moment something fails, demotivates the entire organization and creates a mindset AI is just a buzzword, nothing is working. But believe me, players like us, GeBBS Healthcare, we have ecosystem, we have tremendous data, we have multiple clients. When we try any operational UAT, we have environments to run it on. Without that environment, and we can build solid products. Some of our solutions, as I mentioned to you, this 2000 plus bots running for us goes into every corner and bring data systematically. Now, is it possible for a third party? Answer is no. They keep relying on data to be given to them. If AI needs to run, AI needs to run on a lot of data, real time data, because AI understands. So let me give an example. It's a credential issue, for example. Based on data service, actually, if the credential issues is there from effective date, so and so, if that is not captured real time, you will not get to understand this properly. So I feel that some of this thing needs to happen, and the pioneer should always be companies who have the ecosystem. They can make a good AI product and a successful product. Otherwise, the stories will continue, and it's inevitable. Right now, we have to experiment and fail and take it forward, but it will progress that way.
Yeah, that's a key point of this a message that you just communicated, Ravesh. You need, besides the technology and AI expertise, you need a lot of domain knowledge and even the knowledge of politics, right? How to navigate politics in healthcare. What's that relationship like between the three Ps, the payers, the providers, and the patients, so that you can actually build tools that can be adopted and that works. And I believe as well that some use cases have had a lot of success, which is what we're going to discuss on the next slide. Because AI, as you mentioned, it's being implemented and it's providing significant impact to healthcare companies across the nation.
Absolutely, and it makes a lot of sense actually, because I still feel that we all as an organization also, or a provider, healthcare provider, is jumping the gun too fast on the AI engine without understanding the ecosystem, and we feel that AI will do a magic. AI needs as much investment of a subject matter experts to fine tune it as any other technology. So you have to give and take to AI until it works for you. So just touching upon some of the areas, how is AI, and especially the term agentic AI, and is one of the areas everybody's talking about. But I think I will keep and reserve myself talking about AI specifically because we have still not scratched the surface in the healthcare ecosystem. What are the areas and applications we have been doing as GeBBS Healthcare with such a big development team we have with us? One is definitely I touched upon is a proactive denial prevention. You know, defects which is happening right now, data which is getting accumulated, learning from the data, understand the right compositions, and bring it forward to the front end saying that stop. This AI can do it beautifully, saying that I will not let you go ahead because the probability of getting failed as per my LLMs saying that it will not go ahead. But AI will also look at the current patterns. A pair can change the behavior in fall or it can change the behavior in summers. You don't know. I'm just using that exaggeration there, but you don't know. Pair will get smarter. We'll have to get more smarter. The only way to catch it is AI. The answer to pairs AI is providers AI. That's how we look at it. Second part of it is the workflow optimization. As I briefly touched upon, is that the workflow plays a very important role in terms of taking the data gathered by RPA, applying some AI engines to it, and bringing to the right party. This workflow optimization, if for example, this is, I'm giving a very small example, this is nearing timely filing limit in next 5 days, if you don't do it, for this payer, this will be a short loss of money. AI can read that. A human will have to learn it, but AI can read it and tell you what to do. We are attempting this, saying the risk index and how AI can alert us by payer, by plan. It's not about few pairs, it is not, it's about infinite plans also. Every plan an AI can read and understand, and point of time as well. Smart decision making, when an agent works, as I mentioned to you, gathers a lot of information and use some training algorithms what he uses and try to conclude account and then take actions in form of rebutting it to the payer or repairing it and refiling, reprocessing the claims. It's a finite one. Though there are a few pattern changes, you can hard code it. A lot of organizations have brought a decision tree which are very hard coded. But AI can make it more simpler. AI can make it more real time. AI can adapt the changes which are happening. We are attempting this from our side is AI based, decision making, which can enable, we call it as I assist, as an assisting bot to the human. They click and AI does everything in front of them and stops there saying that, do you think this is right? Let me know. Possible. That smart decision making is something AI can enable, and we are attempting that from our side. Automating prior authorization. As mentioned, authorization have three phases. One, you request for authorization. Two, you wait for authorization, and there's a tolerance limit of wait. 2 days, 3 days before surgery, or three, you then get the authorization and process it forward. But these three phases works in voice and non-voice sector. Nobody should have an expectation that the entire authorization AI will manage it. Answer is no. We start with RPAs for non-voice side of it, start getting into getting the data. Follow-up can be automated via AI. With the algorithm at the back end, they can timely call up, timely visit the website without any human intervention and check whether we received or not received the authorization. If within X number of days for this particular payer, if you don't receive it, action this. AI will learn over a period of time, saying that this is a payer who will never respond you back. And this will have impact in terms of how you take the surgery appointments forward. So use of that and autonomous AR management, I think this is something is in the evolvement. Anything post defect where the entire denial to be worked directly without any human, so bodies gets eradicated and the bots take over. I think this has some time to come. Though we also got some, minor successes where direct to action, what we call it, is that the whole claim goes through the entire AI channel, and it can also get pushed in. We started putting the system with Imagine and push it into Imagine, saying that this is concluded. Did we had a success? Answer is yes. We had very, very minimal success on this. Will this increase? Answer is it will increase. It is inevitable. But a subject matter expertise investment is required to take this forward. With this, I'll stop here. Over back to you, Edison.
Yeah, thank you, Avesh. And that was, again, very insightful. I believe we can use the last 10 minutes to answer some questions from the audience. And just a reminder, you can use the box at the bottom of your screen called Q&A to ask any questions that we may have and that Avesh can answer. We have a couple, and I'm going to read it out loud, Avesh. The first one is, which key metrics should organization track to ensure that they are on the right track in terms of this technology-enabled RCM transformation? How do they measure success in this transformation?
Yeah. So any technology interventions you do it for one reason, for an issue. If you have an issue, you bring interventions. Before you bring intervention, you collect a lot of insights. What needs to be done? When you bring intervention, you expect improvement in impacts. One big impact you bring intervention, and this is getting little on the CFO side of the world, is that you improve your productivity in the current form right now. I'm not saying that you eradicate human being. You do more with less. So one metric which have correlation with a lot of financial metric is productivity. Your productivity is X. Will it go to Y? You have to define that I have to take it to Y. Otherwise, the whole technology intervention is just cosmetics. So I feel that productivity is one zone or metric we should all monitor from day one. Is it changing? If it does not change, then we have to go back and see why it is not changing. Is the solution compatible, practical, and working?
Yes, great. We have another question here. What advice would you give organizations that are starting this journey? And this is a very interesting question, if I may add, that some people and some organizations may be aware of the existence of AI, the existence of this technology. However, they don't know which resources they should query, who should they approach to make sure that they start on this journey towards RCM transformation and AI enablement.
Yeah, and it's a dilemma for a lot of organizations. Every organization who's working as a healthcare provider cannot build their development team, or they try to hire a few people and start building it. They will have a lot of ideas. So it's not that you have solution off the shelf. The subject matter experts who are sitting within the ecosystem can build greater systems, but they are helpless because they don't have a development team. That's where partners like GeBBS really helps, saying that they have an ecosystem, they understand healthcare. You come with your idea, we come with the discovery, we understand that and build bots for you on a fly. We build solution on a fly, your ideas, and it started getting very, very cost effective. If you look at the cost of manpower put on that particular business and utilizing some of this solution, your ROI will be very much visible. But the time to floor or the speed of building this should be faster. That days are gone if you try to build a bot or build a technology solution which will take you 6 months or 9 months. You don't have that time. Bots from a subject matter expert's brain till it's implemented, this should be a 3 to 4 weeks journey. That's how we should look at it.
Makes sense. We have another question from one of our attendees. He says, prior authorizations from insurance companies take time. Will AI programs help with this process?
I feel it will help only in one area. If there is an attempt from payer side of it and changing algorithms, this may have ripple effect. And we had seen when we ran our bots actually on some of the website, they change patterns. When pattern changes, your hard coding will not help, but you are bang there. AI will understand the change of pattern and change dynamically to suit that pattern. So my answer is yes, AI is the answer to it.
Wonderful, wonderful. And the last one that we have, Avesh, is for smaller healthcare organizations with limited budgets, what would be a practical step toward implementing AI in RCM? Especially understanding that technology and especially AI is not inexpensive, even though we've seen the commoditization of some of these LLMs, for example. However, what would you say? What would you advise to maybe a smaller healthcare practice or organization?
So in the last few years, we have seen organizations like Automation Anywhere or UiPath, which has come with very, very expensive solutions, which maybe a mid-tier or a high-end hospital can afford it. But as we move forward right now, there are players, as I mentioned to you, this is offered as services also. So earlier it was more of capex. Now it is getting into the form of opex, where you pay as you go. You use the more you use with some matrices in the contract that this solution will improve my this metric, my financial metric. That stage has come right now. So any small player also can approach any organization, like for example GeBBS Healthcare, come with a contract saying that, and there are at least 5 clients who has come with saying that I'm going to tie up with you. You run our solution. We expect this to go from X to Y. That's a contract deal. Can a healthcare provider doing technology interventions can do it. So small players need not have to worry right now. If they want to experiment, it is going to start getting into cost effective zone.
Wonderful, wonderful. I think with that, Avesh, we can conclude our webinar. But before we wrap, on the next slide, we'll leave you with our contact information. Feel free to reach out. Obviously, there's only so much content that we can cover in a 1 hour session. However, if this is something that is of interest to you and you want to know more or get more information on how to solve some of your RCM issues, and especially the implementation of technology, you'll have all the information on this screen. Feel free to either scan the QR code or just go to shoot us an email to what you see on the screen. You can also get more information on the websites that you see on the bottom right. So with that, again, I encourage you to reach out and ask for more information on the subject. I hope that this was insightful. Thank you, Avesh, for your time and obviously all your expertise that shared here. And then to our audience, happy to have you, happy to host you, and looking forward to our next session. Again, shoot us an email. Learn more about how to improve your RCM processes for your healthcare operations.
Absolutely. Thank you, everyone.